Well, welcome everybody to our YouTube video. It's a great delight for me to be able to welcome back to our YouTube channel Dr. Avi Charlton, who we've met before, and no doubt you've seen her name around if you've been on my channel or in our Facebook group. But today I just wanted really to help you get to know this wonderful lady a bit better, and what makes her tick, and what motivates her. But we did just come back from a Carnivore live event on Saturday, just immediately past in Melbourne, where we gathered in the city for quite an array of speakers, and both Dr. Avi and myself were there. And welcome, Dr. Avi, and thank you for coming on. And could you tell us, first of all, a little bit about what you saw as the highlights from Saturday Carnivore Live?
Oh, hello, Larry. Hello, everybody. Thank you for inviting me back to the YouTube channel, the Carnivore Pensioner YouTube channel. Yeah, we just came back a couple of days ago. We had the Carnivore Live event in Melbourne, which I think it was quite enjoyable. It was amazing. Very well organized. A couple of highlights is I love how people are sharing the journey. The best journey that I liked was Bradley Marshall. He's only 23, he's young, and he showed his journey on how his eczema improved. And I sort of related because my son had a bit of eczema, really not as bad as his. And I do see lots of skin condition, eczema, psoriasis in my general practice. And his journey was amazing, how he transformed his skin and healed his skin with Carnivore, just 2 weeks, and amazingly got better. So certainly very inspiring, given though he's young and he's fit, but his why was pretty big, and he transformed his skin. He had a very big motivation to improve his health. So I loved his story, and I actually shared his video on my Facebook page, and just loved sharing these sort of stories.
Yes, his photos were very graphic, weren't they, of what he'd come through?
Yeah,
And,
absolutely.
Yeah, an amazing story of healing and transformation. And
I certainly see lots of skin condition and eczema, psoriasis in my general practice, and a lot of them have gone through lots of treatment. They can be quite bad, and sometimes in my experience, people doesn't relate that it's to do with food and gut health, and certainly maybe their doctors hasn't really told them that it's related to their food. And there has been instances that I told my patients that it could be your gut health, and you might want to improve your food, and they don't believe in me. They don't want to listen. But sometimes when they do listen, and they have come back to say they have improved their skin because of transforming their food. So yeah, I certainly related to his story.
So when you talk about these other doctors that take more traditional approaches, you were once there, weren't you?
Yeah, absolutely. I actually finished medical school 25 years now. We're just celebrating 25-year medical graduation. We finished in year 2000. And so I've been a GP for more than 20 years. I've been in Montana for 19 years. And I was once a traditional GP who just see coughs and colds, prescribes antihypertensives, diabetes medications, without really looking at diet and lifestyle. So yes, I was once there, but I totally transformed my practice, and it's been a very rewarding journey.
So tell us, what prompted you to begin this journey, or how did you begin to see I've got to do things differently?
Yeah, it's actually quite a gradual transition. It's not like an overnight thing. I wanted to lose some fat because there was a patient who came in and and commented that, am I having a third baby? She said, oh, are you pregnant again? I said, oh my God, no, I've had 2 already. I've had my lot of kids. I've got 2 boys there now, 16 and 13. So I've had my kids, and she thought I was having number 3. But so I decided that I'm not going to be a fat doctor. I looked at the local gym and I signed up to the local gym. And after working out for about 3 months, 3 times a week, nothing changed. No loss of weight. Same as before. And then I decided to participate in this 8-week body transformation challenge, which the gym was holding. And I did it more for fun as well as fear of missing out. So I thought, oh, yeah, okay, let's get it done and try it out. And after 8 weeks, I lost 4 kilos, 4% body fat. And it doesn't sound like a lot to a lot of people, but I'm very petite and Asian. So 4 kilos is actually quite a bit for me, and I've flattened my tummy and improved my metabolic health. In blood tests, that my metabolic markers have improved. And I certainly have a family history of diabetes. My mum had diabetes, which I have now reversed her diabetes by telling her to eat low carb. So that was my personal journey, and that I've decided to look into low carb first. Then COVID came and I looked into more on education, Low Carb Down Under, Nutrition Network, and I had a whole lot more time to look at online learning and listen to videos and photo and talks and podcasts. So I looked into why low carb works, and then eventually over a few years, I started to prescribe low carb, and I looked into other lifestyle things like breath work, stress management, the prioritizing sleep, and importance of sunlight. So many rabbit holes that I've dived into that I've never looked into when I was a normal GP. I hope everyone I hope everyone becomes this sort of GP from a normal GP. I don't know what's normal, but
So did you feel sort of any sort of sense of inner conflict with what you've been taught and what you are now starting to embrace?
inner conflict, yeah, sometimes there is, because I've been taught to prescribe medications, and now I'm prescribing more and more lifestyle. And some patients don't want to listen to it, and they come in and they just want medication. But there are other patients who are surprisingly appreciative that this is what I'm trying to concentrate on, natural things and improving their lifestyle rather than just giving them pills.
Yeah.
So yeah, absolutely.
Yeah. So as part of this journey, you changed your clinic to be the Melbourne Low Carb Clinic.
Yeah, so I have been prescribing low carb for about 4 or 5 years. I did the courses, and then I had my own weight loss program in the normal clinic. Then I listed my name under Low Carb Down Under, and people started to come all over Victoria and even interstate to find me because I've listed my name and they wanted a low carb doctor.
Yeah.
So 2.5 years ago, in October 2022, I woke up one morning on a Sunday morning. I told my husband, I'm going to start a clinic. I'm going to brand myself so people can come and see me. And I'm going to provide longer consultations so we're not so rushed. We're not spending just 10 minutes each consultation in and out of the bulk billing clinic. And patients are going to pay, because paying will be increased investment for these patients to have lifestyle changes. It actually really works. A lot of people who paid the money actually are invested. They are really much more serious than the bulk billing patients that they don't really want to listen to me because they haven't invested on any money.
Yes, I find that with so many things, even like selling an ebook. If you give them away for free, nobody wants it, but you make them a small price, and they suddenly think it must be good. So I understand that principle. So,
Yeah.
so when you made this transition from where you were into the low carb clinic or prescribing lifestyles, did your patient numbers go up or down, or any noticeable change?
There's certainly a build-up of patients in the Melbourne Low Carb Clinic. And I didn't have as much time to see the normal patients, so those numbers have declined. Some people have moved away from me when they're wanting medications because I just keep asking them about how they're eating. So they got sick of me asking them how they're eating. And so those patients have moved away from me. But certainly the Melbourne Low Carb Clinic have grown, and I've grown from one location in Wantirna to 3 locations in Pascoe Vale as well as Paran. And there's more and more patients coming to those 2 clinics, which I'm there once a fortnight. And I'm certainly much more rewarded and feeling very satisfied, and that I've made some changes, made some progress.
Yeah. So how long has it been now since you've become the rebranded clinic?
2.5 years.
2.5
October
years.
2022 is
Yes.
when Melbourne Low Carb Clinic started.
And no regrets?
No regrets. No regrets.
Yeah, yeah.
It is a
Big
lot of
change.
work because, it is a big change because nobody taught doctors how to market, how to sell. I've never needed
Yes.
to sell because I've always the patients just come in, even when it's just coughs and colds.
Yeah.
Flu jabs are popular in the moment, and they just come
Yeah.
in, and we're always fully booked. So I never needed to market myself. But for the last 2.5 years, I've learned about social media marketing and email marketing and visibility, getting myself out and speaking. And I've done Speakers Institute to learn how to speak more confidently. And I'm really hoping that I'll be getting more speaking engagements so I can spread the word of low carb, healthy eating, lifestyle. And ultimately, that's what I'm hoping, that one person at a time, then the word will spread out, that we can improve our health with just paying attention to what we eat, how we move, and how we sleep, how we manage our stress, breath work. And patients will not just look at getting medications.
Yeah, that's a big step, isn't it, for people when they're,
Yeah.
all your life you've gone to the doctor, told your problem, and got a diagnosis and got a script and told to come back next time. That's
That's
been the
right.
pattern in the past, and but so much more rewarding, I would think. So,
Absolutely. Yes.
So, with your experience with low carb and prescribing lifestyle, are there certain medical conditions that you've seen respond really well to a change of diet and a change of lifestyle?
Yeah, absolutely. Diabetes really is great to prescribe them with low carb. And quite often the patients who has diabetes, they've never been told that they should go low carb. They might have been told go from white bread to grain bread, brown bread. They should eat
Mm,
porridge. They should eat whole grain and sweet potato rather than potato. And they never manage their sugars fine. And then the doctors keep putting on more and more medications, tablets, and eventually injections and insulin. So those patients, when I tell them to go low carb, quite often the first consultation, we can take off some medication, which the patients are really appreciative. I would halve their insulin and I would take off some of the tablets that lowers their glucose, and they go away less medication already. So they're really appreciative. And I tell them to monitor their sugar and touch back a week or two. These patients have taken away one or two medication and the sugar still get better. So that's really rewarding. The men do it better as well. The men with diabetes can really improve their diabetes. And when they repeat the blood test 3 months later, quite often they've reversed the diabetes, got off some medication and lose a whole lot of weight. So that's really rewarding.
Amazing outcome.
It is, yeah. Weight loss certainly is great. So treating obesity with low carb, the men do it much better. The ladies quite often will do good good outcome as well. Quite often the ladies, depending on what other things is going on, like if they're stressed or if they've got children that they're running after, or if they've got other conditions like lipedema, sometimes that can affect their weight loss. But it's quite variable. Everyone's very different. So it really depends on the individual and what they like to do.
Yeah, it's interesting. Yeah, I mean, everybody knows somebody with diabetes if they haven't got it themselves. And I could name quite a list of friends of mine who have diabetes, and most of them, I observe them are still eating a lot of sugar and a lot of carbs, and if you say anything to them, they say, "I'm taking my tablets," and even one friend of mine said, "Well, my doctor said everybody's going to get diabetes, so it doesn't matter." And I thought,
Really?
yeah, what a thing to say to a patient.
Well, it is certainly more and more common, but we can certainly control it and we can reverse it and we can reduce our risk of complications, because diabetes isn't benign. There's so many things that can happen. For example, heart attacks, strokes, and even kidney disease, losing legs, losing toes.
Yeah, it's
And
pretty serious.
it is, yes, going blind is pretty drastic.
Yeah.
So you don't want to go blind, because the small arteries can be blocked with diabetes, and it's really reducing your health span. You had a video on lifespan versus health span, and with these chronic conditions, that really reduces your health span. You're not as healthy for the last 20 years of your life. Imagine you live from 60 to 80 with poor health, compared to if you live till 80 with good health, with 20 more years of amazing health.
And so many people just think, "Oh, that's normal. That's just getting old." And you think it can be
Yeah,
so much better.
I know. It all depends on the choices you make now.
Yeah. I was going to ask you. I was going to come back to talking about cholesterol a moment ago, which is it's a big concern for a lot of people. They go to the doctor and they get their blood work done, and
Yeah,
the doctor says, "Oh, your cholesterol's a bit high," and
yeah.
then they next thing they're suggesting a statin. And is there, if a patient goes to see their doctor and they're having that conversation, is there any how would you advise a patient to navigate that conversation?
Yeah, it's really common. They come in to see me and they want a second opinion. So I certainly am happy to give them a second opinion. I'm happy that they come in to see me. And I say that it's their decision to take a statin or not. The doctor's job is to provide them with the information, but it's the patient's body, and it's up to them whether they want to take it or not. And I give them some figures and risks of their risk of having a heart attack. And to work that out, there's the other markers in the cholesterol profile, which are much more indicative of your metabolic health than the total cholesterol. So I encourage the patients to look at the other bits of the cholesterol profile. For example, the triglyceride and the HDL, or good cholesterol. So the doctors actually know that we should aim to reduce the triglyceride, because high triglyceride is part of the diagnosis of metabolic syndrome. And poor HDL, or poor good cholesterol, is also not good. So we want high good cholesterol and we want low triglyceride. And this combination is actually much better to interpret your metabolic health compared to the total cholesterol. And then a lot of patients worry about the LDL, or we used to call it bad cholesterol. But it took me a while, but I've come to unlearn and relearn that LDL is not all bad. And there's lots of different subtypes of LDL. There's actually 7 subtypes. The LDL, we can break it down to LDL type 1, 2, 3, 4, 5, 7, 5, 6, 7. And the bigger ones are type 1, type 2. The smaller ones are 5, 6, 7. And they are also called the small dense LDLs. And
So
it's actually they're the real
they're
bad.
a bigger concern than the big soft ones.
Yes, that's right. They're the really bad ones. Whereas the type 1, type 2 LDLs, they're actually quite big and fluffy, and there's studies and showing that they don't increase your risk of clogging arteries, atherogenesis. So the smaller, denser LDLs, we can measure it using a special test called the LDL subfraction. And if we measure this test and there's not much small, dense LDLs, then I can be confident to reassure you the risk is actually quite low. But I would also like to get a coronary artery calcium score to factor all that in and interpret the whole person, including other markers like HbA1c, insulin, waist circumference, blood pressure, family history. All those things should be included to interpret your risk of heart attacks rather than just your total cholesterol and LDL. So that's how I approach my patients, to tell them their risk of cardiovascular risks rather than just 1 or 2 numbers.
So if you changed sides of the desk and you were the patient, what do you think you should expect from your doctor when you go and see a doctor? What do you think is the standard of care, or what's your expectation?
Yeah, I think the doctors should be listening to the concerns. So I try to listen to the patient's concern and pay attention to what they really want. What's the goal of the consultation? What's the goal of the patient? What's the why? Why are we doing this? And what's the aim of the lifestyle change? I think for a lot of patients, it's to improve longevity, to improve their energy, to lose weight and reduce the risk of chronic conditions. So I think listening to the patient's concern is really important. And again, if I was the patient, I would really want my doctor to listen to me and provide me with the information. And then I would be happy to make the decision if I was provided a well-rounded case of to take or not to take, or other options, natural options, lifestyle options, and whether there's other medications that can be considered, or vitamins or supplements. Again,
Yeah.
it's up to the patient to decide. And certainly I would encourage the patient to go do their own research, go read this person's book, and you can look up YouTube and then we can discuss it.
Of the whole scope of medicine now, what is the one thing you would most like to see change in medicine, in the practice of medicine?
I would really love more doctors to look into lifestyle and ask the patients about what they're eating, if they're exercising and they're going outside, sunlight exposure. I would love the doctors to look more into lifestyle and discuss all that with their patients. So just would love my colleagues to spark more interest into looking into alternative treatment rather than just medications. Yeah.
And so as you look at the whole medical scene in Australia, are you optimistic or pessimistic?
I think I am, because there's more and more education programs, there's education days, and the doctors are curious to learn. Like Defeat Derby organized an education day in Sydney, and there's quite a lot of people signed up, and I helped to spread the message on the doctors' social media. And even the live stream, I think there's a few hundred people that signed up.
Yeah.
And sometimes when I post comments that you can improve diabetes with lifestyle, with low carb, and I get a few likes, but I get a few pushbacks from doctors who think plant-based and meat kills them and increased risk of cancer. So I'm getting a few pushbacks, but there's a few likes there.
Yes.
So yeah, I think the message is certainly very confusing, because most of the doctors have been taught by the plant-based propaganda.
Yeah.
And they worry about increasing bowel cancer or increasing inflammation with red meat, that sort of thing. So it's certainly very confusing.
Yes. So I admit I have some days when I just are totally depressed, and I think we've just got so far to go. And other days I'm really encouraged. I see people like yourself and so many other positive signs. The Carnivore Life event and the Low Carb Down Under movement, and the information that's available. And I think, this is changing. It's slow, and we want to see a much quicker rate of change. But I think there's green shoots everywhere, and if we had more Avi Charltons, the world would be a better place.
Yeah, so, I've been linked it to the cigarette industry. So it took maybe 10, 20 years for the cigarettes to be realized it's not good for your health. And maybe the sugar industry might take 10, 20 years for the sugar to be more demonized, and we realize that all the carbs become sugar, and sugar is just no good for you. But it's difficult because it's so addictive and so yummy.
Yes. So just one last question. If somebody's sitting here watching you now and they're struggling with their health and they're a bit down about it all, what would you encourage them to do?
I would encourage them to be curious. So being curious can be, they might want to learn a bit more from, again, you mentioned the internet, the YouTube, lots of podcasts, lots of reputable places. Be curious that they can change. They might think they can't change because they're stuck and they're depressed and their negative thoughts are telling them they can't change. Be curious. You might be able to. You can do small steps, or you can do big changes. So be curious about your health and yourself and your thinking. And be curious about the people you meet. You might decide to come to a event that I organize, and then maybe spark them to come in to see me for a consultation, and maybe they can be more open-minded to unlearn and relearn about the whole nutrition paradigm, or they might be able to stick to a plan. Maybe they need some coaching. Maybe they can go into a bit of learning. So that's what I would encourage, is being curious.
Yeah. And if people living in Melbourne and they think, I would like to go and see Avi Charlton, they have, I'll put a link to your clinic down below in the description. But you offer more than just 10 minutes with patients. You have options where people can have half an hour or even 45 minutes.
Yeah, absolutely.
Yeah.
That's right. So they can head to my website, Melbourne Low Carb Clinic. I offer 45 minutes, 30 minutes, and 15 minutes consultations. And I've collaborated with a health coach, and she's a nutritionist as well, Carter Feed Carter. And we've got a metabolic makeover program, which comes in a package with 2 of my consultations, 4 of her consultations. And that is a package that people can sign up, and they get lots of coaching. And I've got a podcast called Prescribing Lifestyle, so people can listen to my message and see if they like me. And there's 1 year anniversary on the 1st of May, which is a few days' time. So I'm celebrating 1 year podcast anniversary, up to 90 episodes of my podcast, and they can check it out. And or they can just they can just find me on Facebook and Instagram under Dr. Charlton Lifestyle GP.
Yeah. Well, Dr. Avi, thank you very much for your time. You've always been incredibly generous with your time and in sharing with us here. And as I said, I will leave the links to Dr. Avi's clinic and other things that she does, the podcast, down below in the description. But thank you for coming and being part of our program.
Thank you, Larry, for having me again. And it's always a pleasure talking to you. I love what you do. I love your channel, and I love how you spread the message of how everyone can improve their lifestyle.
Yeah, okay. Thank you, and we look forward to next time.
Thank you.